All right, today we're going to do something a little different. We're not just looking at dental x-rays, we're going to learn how to actually read them. We're going to decode all the little secrets hidden in those shades of gray and see how these simple shadows can tell us a whole diagnostic story.
So, when you look at an image like this, what does a dentist really see? I'll tell you, it's a whole lot more than just some black, white, and gray shapes. It's like a diagnostic puzzle. The real key here is learning to see these things not just as pictures, but as super detailed maps of a patient's oral health. And sometimes, even their overall health.
But, before we can even start to read that map, we got to learn the language. And in the world of radiography, that language is all about light and shadow. It really comes down to understanding how this invisible beam of energy creates the image we're about to dive into.
Okay, so the easiest way to wrap your head around this is what I call the shadogram principle. Seriously, a dental x-ray is just a recording of shadows. The x-rays go through the patient, right? But the really dense stuff like bone or a metal crown, they block more of that beam. So what happens? They cast a bright, light shadow. On the flip side, the less dense things, think soft tissue or decay, they let more x-rays pass right through, which creates a darker shadow. It's really that simple.
And that whole shadow thing? Well, it gives us the two most important words you're going to hear today, radiolucent and radioopaque. So radiolucent, those are the darker parts of the image. That's where the x-rays just sailed right through. Think of the pulp, an abscess, or a cavity. Then, on the other side, you've got radioopaque. Those are the bright, white parts. They represent all that dense material, like enamel or a metal filling that block the beam. Honestly, if you can get these two concepts down, you've got the foundation for everything else we're going to talk about.
Now here's a super critical rule in all of this. You simply can't spot what's wrong until you've completely mastered what's right. Every single x-ray is like a landscape, and it's filled with normal anatomical landmarks. Being able to recognize those landmarks instantly, well, that's what really separates a beginner from an expert.
So let's start with the upper jaw, the maxilla. There are certain landmarks we should just expect to see. For instance, that big, dark area you see above the back teeth? That's not a problem. That's just the maxillary sinus. And what about that really distinct U-shaped white line that you often see right over the molar roots? That's the zygomatic process. See? These aren't scary pathologies. They're the normal, expected features you've just got to know by heart. And hey, the exact same idea applies down in the mandible, the lower jaw. You can trace that dark, radiolucent band in the back. That's the mandibular canal, and that's where the nerve lives. And then up near the premolar roots, you're going to look for this little round dark spot. That's the mental foramen. Knowing these landmarks isn't just for, passing a test. It is absolutely essential if you want to avoid a misdiagnosis.
And here's exactly why that knowledge is so critical. It's a classic trap. The mental foramen can sometimes line up perfectly over a premolar root, and it can look exactly like an abscess at the tip of the root. So, how do you tell the difference? Well, the key is to trace the lamina dura. That's that thin white line that goes all the way around the root. If that line is intact and unbroken, you're almost certainly looking at normal anatomy, not a problem.
Okay, so now you know the language, you know the landmarks, but let me tell you, the single biggest mistake anyone makes in interpretation is getting tunnel vision. Where you only focus on what the patient is complaining about. To be a real diagnostician, you absolutely need a systematic process. And this quote, man, this really hits home for anyone who's ever worked in a busy clinic. The pressure's on, right? It is so easy to just make a snap judgment. A patient comes in, points to a sore tooth, and boom, that's the only thing we look at. But that kind of habit, that's how you miss something really bad, like an early-stage malignancy or some other critical finding on the total opposite side of the image. So the solution is a really simple but incredibly powerful system. I want you to think of it like a pilot's pre-flight checklist. Step 1, assess the quality. Is this image even good enough to use? Step 2, evaluate every single tooth, from the crown all the way down to the apex. Step 3, examine the periodontium. Trace that lamina dura around every tooth and look for any breaks. And finally, step 4, zoom out. Scan the jawbones, the TMJ, just everything else in the picture. This process right here is what takes you from being a simple spot checker to a true diagnostician.
All right, so we've got our system. Now it's time to actually put it to work. We're going to use everything we've learned, our knowledge of shadows, the landmarks, and that methodical scan, to start decoding the signs of some really common diseases.
Okay, let's kick things off with caries, cavities. Decay between the teeth, or proximal decay, it follows a pretty predictable pattern. It starts out as just this little radiolucent notch in the enamel. That's what we call incipient. Then it forms a classic little triangle shape in the enamel. But here's the key moment. When it hits that boundary between enamel and dentin, the DEJ, it spreads out sideways along that junction before it really dives deeper into the tooth. Being able to recognize these different stages is absolutely crucial for deciding on the right treatment.
Next up, let's talk about the periodontium, the structures supporting the teeth. On the left side here, you're seeing what health looks like. A nice, sharp, radiopaque alveolar crest, that's the bone, and a crisp, unbroken lamina dura around the root. Okay, now look to the right. When you've got disease, that crest gets all fuzzy and indistinct. The lamina dura starts to break down, and then you start to see those telltale patterns of either horizontal or vertical bone loss. The signs can be subtle for sure, but they are definitive.
All right, you ready? Time for some rapid-fire case files. First up, the radicular cyst. So, what's the classic look? It's a really well-defined, circular, dark spot, a radiolucency, right at the tip of a non-vital tooth. The real giveaway, your key clue, is that corticated border. It almost looks like someone took a pencil and drew a clean white line right around it.
Okay, next case file, the odontoma. This thing is a dense, very bright white, radiopaque mass. Now, if it just looks like a jumbled mess of tooth stuff, we call that a complex odontoma. But if you can actually see little tiny tooth-like structures inside of it, that's a compound odontoma. And pretty much both types are usually wrapped in this thin, dark, radiolucent line.
And for our final case file, TMJ osteoarthritis. See, now we're looking way beyond the teeth. Some key signs of this kind of degeneration include a flattened condylar head, these little bony spurs we call osteophytes, and an increase in bone density, which is called sclerosis. This just goes to show how much an X-ray can really tell us about the entire system, not just the teeth.
And that actually leads us perfectly into our final and maybe the most important section of all. A dental radiograph, it's not just an image of teeth. You have to think of it as a window into the entire maxillofacial complex. And sometimes it can provide absolutely life-changing insights into a patient's overall systemic health.
You know, this is where our job as dentists becomes incredibly important. On a routine panoramic X-ray, you're not just looking at teeth. You might spot these little radiopacities, these white spots in the soft tissues of the neck somewhere around the C3-C4 vertebrae. Those aren't just artifacts or mistakes on the film. They could be calcified carotid atheromas, which are a potential marker for stroke risk. You could find salivary stones or even abnormalities in the cervical spine. Sure, they aren't dental findings, but they are absolutely critically important.
And that brings us right back around, full circle, to why that systematic approach is so crucial. When you take the time to methodically scan the entire image, the whole captured volume, you stop being just a tooth doctor. You really become a primary healthcare provider. You're screening a vital region of the body for signs that could, quite literally, save your patient's life.
So the next time you pull up a radiograph, I want you to force yourself to see beyond just the chief complaint. Remember, the teeth are just the beginning of the story. You have to always ask yourself, what else is this image trying to tell me?